Okay, let's talk about filtration. What is filtration in kidneys? Well, filtration, we have the filtration fraction, which equals GFR divided by the renal plasma flow. Normal filtration fraction is about 20%. Okay, normal is about 20%. And what is filtration? This is filtration. When coming from the blood comes, the whatever is coming, it gets filtered in, is filtration. When that thing, let's say it's a whatever it is, let's say it's a pH, that goes and gets reabsorbed back into the blood, that again can come all the way through, all the way back line, right? Can go reabsorbed, and something that is in the blood can go get into this filter by getting secreted, and whatever is here it gets excreted. So going back to the filtration, this is filtration. Normal filtration fraction is about 20%. Filtered load equals GFR times the plasma concentration. The filtered load is GFR times the plasma concentration. GFR can be estimated with creatinine clearance. We talked about it, that it is not only estimated, but the creatinine clearance overestimates the GFR. Inulin, on the other hand, 100% correctly estimates the GFR. Renal plasma flow is best estimated with PAH clearance. Very nice. So renal plasma flow with PAH clearance. Prostaglandins dilates the efferent arterioles. Angiotensin 2 constricts the efferent arterioles. The mnemonic wise is a really good one. Prostaglandins dilate, so PDA, right? Prostaglandin dilate afferent arterioles, PDA, while ACE, angiotensin constricts efferent arterioles. Instead of having ACE like angiotensin converting enzyme, we call it angiotensin constricts the efferent. Look in here, we have prostaglandins. They preferentially dilate the afferent arteriole. So when you dilate the afferent, guess what? You have increase in renal plasma flow. Renal plasma flow increases. GFR increases. So no change in the filtration fraction, because you have changed both of them. Remember, the filtration fraction is GFR divided by the renal plasma flow. So if you have increase here, you also have an increase in this one. So you have no change. You would see change if you have increase and decrease of one another, or decrease and increase of one another, right? But here, because you have same changes, increase or no change in the filtration fraction that is mentioned by here. Then looking at this, so afferent arterioles, and then you have this the podocytes, the Bowman's capsule, the parietal layer is the Bowman's capsule. We have the Bowman spaces here. Then you have the podocytes, and then you have the basement membrane. This is the basement membrane, and then you have this fenestrated capillary endothelium, right? Let's look at the efferent side now. Efferent constricts the angiotensin constricts the efferents. That is when you constrict your efferents, what is going to happen when you constrict this? You are going to increase the GFR, because when you're inhibiting or constricting it, the blood remains back, so more and more gets filtered. You increase the GFR because you also have decrease in renal plasma flow, because more plasma is not even coming down, so you have decrease in plasma flow. So when you apply them, GFR increased divided by decrease equals increase in the filtration fraction. That's what I mentioned here, increase in filtration fraction. I hope that is pretty clear. What else can we think of? Okay, we can say now the NSAIDs, ibuprofen, they are going to inhibit the afferent arteriole dilation, which leads to afferent arteriole constriction, which leads to decrease in the renal plasma flow, decrease in GFR, and again no change in the filtration fraction. Okay, and that's to the NSAIDs. But here you have the ACE inhibitors. Again, it's going to inhibit the efferent arterioles, will lead to efferent dilation, and that dilation leads to increase in renal plasma flow. And you also have decrease in GFR, and leading to a decrease in filtration fraction. Okay. Okay, now let's talk about this point here, the prostaglandin. So patients with intravascular volume depletion, that's one thing, and CDK. So you have depleted the volume, and you have CDK. Volume depletion meaning that can develop into CHF, diarrhea, or excessive diuresis. These all can lead to intracellular volume depletion. All you have on top of this, you have this CKD, which is chronic kidney disease. So in these patients, they need prostaglandins, because prostaglandins are needed to maintain their GFR. And if you were to give NSAID inhibit, it would lead to inhibition of all of this, which would lead to pre-renal azotemia. If not prostaglandin, then you can lead to pre-renal azotemia. Okay, let's look at this dynamics. Changes in glomerular dynamics. When you have an afferent arteriolar constriction, afferent is the one that is coming. So what's going to happen to your GFR because you have constricted? So the GFR is going to decrease. What's going to happen to your renal plasma flow? That is also going to decrease because you have constricted the coming traffic, right? And what is going to happen to your filtration fraction? So if this is decreased, they're equal, no change. What about when you to the efferent, when you constrict the efferent? So you're trying to block the blood flow from the efferent, not block, but vasoconstrict, so that more and more remains in the glomerulus. So when more and more remains in the glomerulus, it increases the GFR. But again, the plasma flow remains the same because not the plasma is not increased, right? But now since you have increase and decrease, so increase divided by decrease in GFR is going to increase your filtration fraction. Let's talk about increase in plasma protein concentration. When you have more proteins in the concentration, you have decrease in GFR, and you have no change in renal plasma flow. And for the filtration fraction, you have decrease in plasma protein concentration. That would increase the GFR and increase the filtration fraction. Constriction of ureters. When you constrict the ureter, right? So constriction of ureter causes decreases in GFR, No change in renal plasma flow, leading to overall decrease in filtration fraction. Dehydration, very important. It's going to decrease the effort, way too much decrease in renal plasma flow, but increase the filtration fraction. Okay, that's what we have for the filtration.